Right now, if you're holding your phone in your left hand, that hand is connected to a part of your brain that can process information your speaking mind has no direct access to. Your right hand answers to a completely different set of rules. This isn't a metaphor. It's neuroanatomy, and it was discovered almost entirely by accident through one of the strangest series of experiments in the history of neuroscience. In the 1940s and 50s, doctors treating patients with severe, drug-resistant epilepsy tried something radical. Seizures were spreading like electrical storms from one half of the brain to the other through a thick cable of nerve fibers called the corpus callosum, roughly 200 million fibers connecting the left and right hemispheres. So surgeons began severing it completely. The seizures stopped. But something else happened, something nobody expected. In the 1960s, neuroscientist Roger Sperry, working with his graduate student Michael Gazzaniga, began testing these split brain patients. What they found reshaped our understanding of the human mind and eventually earned Sperry the Nobel Prize in Physiology or Medicine in 1981. Here's the setup. Your eyes are wired in a peculiar way. Information from the left half of your visual field travels to the right hemisphere of your brain. Information from the right half travels to the left hemisphere. Normally, the corpus callosum instantly shares this information between both sides, so you experience one seamless picture of reality. In a split brain patient, that bridge is gone. The two hemispheres can no longer talk to each other directly. So Sperry and Gazzaniga designed an experiment. They flashed a word, quickly, to only the left side of a patient's visual field, which routes exclusively to the right hemisphere. The patient could not say what the word was. Ask them directly, and they'd insist they saw nothing at all. But then researchers gave the patient's left hand, controlled by that same right hemisphere, a group of objects hidden from view. Without any conscious awareness, without any ability to explain why, the left hand would reach out and correctly pick up the object matching the word. The left hand knew. The mouth had no idea. This is the key discovery. In most people, the left hemisphere of the brain controls language. Speech, naming, verbal reasoning, almost all of it lives there. The right hemisphere, meanwhile, handles something different: spatial relationships, facial recognition, holistic pattern processing, emotional tone. And critically, the right hemisphere controls the left side of your body, including your left hand. So when information reaches only the right hemisphere, and the corpus callosum can't share it, your speaking brain genuinely does not know what your left hand knows. In split brain patients, this created bizarre, almost comedic results. Gazzaniga once showed a chicken claw to a patient's right hemisphere and a snow scene to the left hemisphere. Asked to pick related images, the patient's right hand pointed to a chicken. The left hand pointed to a snow shovel. When asked why, the patient's speaking left hemisphere, which had only seen the chicken claw, calmly invented an explanation. The chicken claw goes with the chicken, and you need a shovel to clean out the chicken shed. The brain wasn't lying. It was doing exactly what the left hemisphere always does, constructing a coherent story out of incomplete information. Gazzaniga later called this function the interpreter, a built-in narrator that stitches together explanations, even when it's wrong. Now, you don't have a severed corpus callosum. In your intact brain, information flows freely between both hemispheres, constantly, in both directions. But the underlying wiring, the specialization itself, is still there, quietly shaping how each hand processes information before that information gets shared. Studies on healthy, non-split brains have found measurable differences in how each hand handles certain tasks. Your left hand tends to be faster and more accurate at recognizing spatial relationships, judging distances, reading facial expressions presented briefly, and processing information holistically, as a whole, rather than piece by piece. Your right hand, tied to your language-dominant left hemisphere, tends to be quicker with sequential, verbal, or step-by-step tasks. This is part of why some artists and musicians report that their non-dominant hand seems to know a gesture or shape before they can consciously describe it. It's also part of a much stranger, rarer phenomenon called alien hand syndrome. In cases of severe brain injury, stroke, or in rare instances following corpus callosum surgery, patients report that one hand, almost always controlled by the opposite hemisphere from their dominant language center, begins acting with what feels like a will of its own. It might undo a button the other hand just fastened. It might reach for an object the patient consciously insists they don't want. The patient isn't confused about what's happening physically. They can see the hand moving. What's missing is the felt sense of having chosen the movement, because the request never crossed the bridge that normally makes an action feel like mine. Neurologists studying these cases believe alien hand syndrome exposes something usually invisible, that a sense of intention is stitched together, moment to moment, by communication between brain regions that we normally never notice working. When that communication breaks, even briefly, the illusion of a single, unified decision-maker breaks with it. This raises an uncomfortable question. If a severed or damaged connection can reveal two somewhat independent processing systems inside one skull, how sure can any of us be that our intact brain is really one unified mind, rather than two specialized systems, constantly negotiating, constantly translating, constantly agreeing to present a single story to the world? Some researchers now think that even in a fully intact brain, moments of hesitation, gut feelings your words can't quite explain, or the sense that your body knew something before your conscious mind caught up, may be small echoes of this same underlying architecture. Not two people in one head, but two specialized processors, working in parallel, sharing information so fast and so constantly that the seam almost never shows. Almost never, until a scientist flashes a word to half your vision and lets your left hand answer a question your mouth was never asked. So the next time your left hand reaches for something before you've consciously decided to move it, or you sense a threat, a mood, a shape in a room before you can name it, consider this. You may not be imagining a hidden layer of perception. You may be catching, for a fraction of a second, a signal crossing from a hemisphere that knows things your speaking mind hasn't caught up to yet. Your brain isn't one voice narrating a single, unified experience. It's two extraordinary specialists, working in near perfect sync, and occasionally, just occasionally, letting you glimpse the scene.